Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. We got a great show this evening, something I haven't done in 3 years here. We have a urologist on the program, and a very decorated one, if you'd say that, in that kind of ranking for this area. He's from Florida Medical Center. We're going to be talking a lot about different urology ailments, treatments, conditions, etc., for men, women, the baby boomer and senior population, which we talk a lot about. And so without further ado, I want to welcome to the program Dr. Ralph Zagha. He's a urologist at Florida Medical Center, a campus in North Shore in Fort Lauderdale, and he also has a private practice we're going to talk about as well this evening. So if you have any questions, call in 888-565-1470. But Dr. Zagha, thank you so much for making it to the program. Welcome.
Great. Thank you, David, for having me. Appreciate it.
Thank you for taking us on this adventure of health, because like I said, we've never talked urology on this show because we've never had a urologist. So seems like they're far and few between. Is it a specialty that's growing, or is it kind of you got specialists in certain areas and that's what you got?
So like you said, there's quite a few urology ailments, especially as we get older. There are a number of urologists down in South Florida with our baby boomer population, and we'll speak in a few minutes about the different ailments. But there were a select bunch of group of people, very well trained, and we all tend to have a lot of fun with it.
I think that's what I got you hit on the nail there, select, because it's been hard to get one on the program. I'm so glad we connected. So please tell the viewers and listeners a little bit about what you do. Because urology, I don't know much about it, but as I research it, there's a lot going on.
Sure. So a little bit about myself. I'm originally from California, trained in Boston. So I went to medical school at Tufts University, and I stayed in Boston for my urological training, internship at Massachusetts General Hospital, did a year of research and residency at Leahy Clinic. Met my wife in Boston, and she did not appreciate the Boston winters, having been from Florida. So we've been the last 14 years down here. And I love what I do. I see a lot of different urological ailments, ranging from blood in the urine to urological cancers we'll speak about later, to kidney stones, to prostate enlargement, to urinary leakage. So it makes things interesting.
Yeah, definitely. Those are some of the terms we know a little bit about. So let's start with seniors and the baby boomer population. I believe it's still the largest group of population demographic in the U.S. for now. So what kind of things do seniors walk into the office or hospital with, and what are some of the ways that seniors can still prevent those ailments?
Sure. So most of my patients are in that 55 and above population with different issues, most of them stemming from urination problems, whether it's peeing too much, peeing too often, leaking urine. They can have, in the men, prostate issues that we deal with either medication or surgical options. In the women population, basically, there are different reasons why the bladder is not working properly. And again, we have different medical versus surgical options for those. Other issues we deal with for men, for prostate cancer, very common. 1 in 8 men will be diagnosed with prostate cancer. We're getting better at diagnosing and treating prostate cancer, both minimally invasive with radiation therapy and even what's called watchful waiting, which is not actually treating it and just following it to make sure it doesn't get more advanced.
Yeah, and that's just seeing the doctor on a regular basis, so they can, surveillance and just kind of wait and see. That's kind of a nice approach for the consumer. I mean, they have the thought in their head, like, is it going to go away, or is it going to be an issue? But at least they don't have to have anything done, and there's a doctor watching over it.
Sure, and everything we do has a patient in mind. So everything that we do in the office is collaborative, is based on what the patient, basically their desires and their expectations, and we give them options and take everything into consideration.
And I'm going to bounce back to prostate as we get into it a little bit later. But ladies first, so what's the most common urology condition you see for women?
So for women, for urinary issues, there's what's called overactive bladder. It's the condition where the bladder has some urgency to go to the bathroom, some frequency, and going to the bathroom at nighttime. It may cause urinary incontinence, which is a leakage of urine where you don't have time to get to the bathroom. And millions of women suffer from this disease, and basically could be very easily treated, typically with medical therapy. There's other options for nerve stimulators. We're using Botox to inject into the bladder, different options for overactive bladder. On the other hand, there's an incontinence called stress incontinence, where you sneeze or cough and urine leaks out. Mm-hmm. Some women could have both, or you could have predominantly one or the other. The stress incontinence is treated typically with a procedure where you would bulk up the urethra or make it more compressive.
Okay. And you said both are easily treated. I mean, just go see the doctor. And
go see the doctor. Women should not have to suffer with urinary leakage.
Do a lot of women wait before they come and talk to you? I mean,
unfortunately, they do. And they could either start the discussion with the primary doctor, with the gynecologist, with the urologist, so there are a lot of different options there.
Yeah, I think people in general, men and women, sometimes wait too long on some issues. I know I have. So, all right, we'll bounce right to men. What's the most common men? I think I know what it is, but I'm going to let the expert.
Well, let's start with the same urinary issues where you pee too much, the stream is weak, and that could stem from a prostate issue. And again, we have medical and surgical therapy for the prostate. Men also for prostate cancer and PSA screening, which is a blood test you do typically once a year in your 50s and 60s. And if elevation can suggest a prostate issue or prostate cancer. And finally, a lot of men come with erectile dysfunction, trouble with the erection, which, again, we have a lot of therapy for that.
Definitely. Now, we're here with Dr. Ralph M. Zagha, M.D., board certified in urology. He's the chief of staff at Florida Medical Center at Campus North Shore, great hospital in the Lauderdale Lakes, Fort Lauderdale area, right there on Oakland Park Boulevard. I'm going to give out that information as well. But also has a private practice. Best way to get there is drralphzagha.com. It's Dr. Ralph, and then Zagha, Zagha.com. Great website, Doctor. I told you in the green room there, I love how it's broken down in hospital and office procedures. That is huge because there's so much that can be done in the hospital, but there's so much that can be done in the office, and that's great. It really is. So check him out there. Again, he's the chief of staff at Florida Medical Center. You've been at Florida Medical Center a little while now.
So I've been there 14 years.
Oh, congratulations.
It's a great hospital,
run.
A great area. And as you said, I've been chief of staff there for the past 2 years. And I enjoy what I do. The hospital's fantastic. We're doing more and more outpatient surgery there. Most of what I do, you go home the same day. And as you mentioned, there are a lot of office procedures we do that we're basically trying to make it convenient for the patient. A lot of the patients have high deductibles, high copays. So we're doing procedures in the office like looking into bladders, ultrasounds, even vasectomies and circumcisions in the office.
In the office.
Yep.
That is great, where people, they can leave there the same day, no hospital stay. It's, something that plans and can be managed at home, prescription.
Correct.
That's great, Dr. Zagha. So let me give out the hospital info, and I'll give it out again a couple times. and then we're going to talk about Dr. Zagha's private practice a little later in the show. So it's floridamedcenter.com is the website. You've heard me say that many times. We have a lot of great doctors on from there. 5000 West Oakland Park Boulevard in Lauderdale Lakes. It's pretty much, if you take 95, it's Oakland Park Boulevard a little bit west, and then it borders the turnpike, but there's no exit at this time. But a great hospital, a busy hospital, and a hospital that has come a long way in the last few years. It looks great. I was there Friday actually, and it's always been very clean, and a lot of history there. First open heart surgery in Broward County, and then some of the things that you and your peers are doing there. So
we have great medical staff, great administration. We do cardiac surgery, orthopedic surgery. We got a very robust group of
robotic
people.
surgery as well.
Surgery.
Yeah. And, we had the CEO, Jeff Welch, on not too long ago, Jeffrey Welch, so appreciate that. The number is 954-735-6000. Again, it's floridamedcenter.com. So the prostate, what is the prostate? Because I hear I'm asking questions about the prostate. I don't think I'm that age yet, but I got to start thinking about it. What is it, and what age range, second half of the question, what age range should men start thinking about getting it checked? Sure.
So the prostate is a gland that men have. It basically is around the urethra near the bladder, and its function is to store sperm and the seminal fluid and to expel it during intercourse.
Okay.
So as we get older, all of our prostates grow. Some grow more than others, and it could be hereditary. And as it grows, it can compress the urethra. It can make it difficult to urinate, and it can make you urinate more often at night. And as we treat the prostate, whether it's medication, usually the initial step, or surgical treatments, some of those side effects can affect their function, which would be a reduced or low ejaculate. Okay. It should not affect necessarily the erections themselves unless you're talking about a cancer operation.
Okay, and then it can turn into cancer if it's left untreated?
So prostate cancer is going to be separate from the growth. You can have one or the other or both. So it's going to be totally separate. Now, the second part to the question, as far as what age group, that's a controversial discussion. The urologists like to screen patients age 55 to 69 or 70 with an annual PSA check, which is the blood test you can get with your urologist or your primary, and also a rectal examination, a finger check to feel the prostate. We're checking for the prostate size. We're also checking for prostate nodules. The screening is controversial because it does detect more cancer. It actually does save patients' lives. However, it can create more side effects and morbidity in the form of erectile dysfunction, in the form of urinary symptoms after treatment. So different societies may suggest different screening parameters.
But that is great information. If you want to come, check back to the show, it's on Facebook.com, All County Healthcare INC, or it's on their website, allcountyhealthcare.com, because that is great information to know. Now, that prostate check, would I be referred to a urologist, or do I go to primary care? But it's okay just to go directly to your office, right?
Yeah, some patients do prefer to come directly to our office. Some patients are screened by their primary and would refer only if there's an abnormal check on the prostate, or often if the PSA is rising or abnormal, then they would refer to us for further management.
That's great info there, Dr. Zagha. Again, it's Dr. Ralph Zagha. He's the Chief of Staff at Florida Medical Center, and then also in private practice as well. And I'm going to give out that info a couple times. So my another question I had, so also with men, testicular cancer. So I remember was younger, maybe adolescent age in school, they taught us after a shower to do a self-check, and if you felt a pea-sized nodule in your testes, to actually go to the doctor and have it checked out. Is that still something that is effective today?
Sure. So we still want folks checking their testicles, usually on a monthly basis, typically in the shower, or where you can get a good feel of the testicles. There are a couple of groups that are at risk for testicle cancer. One is the younger group, maybe the late teens, and there's a group in the 60s that can also get testicle cancer, and of course anywhere in between. So we do recommend a monthly check, and to bring it up to your primary doctor or urologist if you do feel a bump or a mass. The good news is that testicle cancer is fairly rare. We do see a bit of it. And the other good news is that if you do feel a bump, most lumps you feel in the scrotum are benign. So it can be a cyst, it could be what's called a spermatocele, a collection of sperm, it could be a dilated vein. So you do want all of that checked out. We typically, the next step would be an ultrasound, sometimes some blood tests. So again, if you do feel a bump, not to panic, but to see your physician, typically get an ultrasound to further evaluate that bump and go from there. So we do recommend a monthly check at home.
Now, can those bumps come and go and kind of move around? Like, not the same one, but can they appear and then get ready to go to the doctor and they're gone?
Sometimes they can, or the testicle can shift around. Oh. That's more common maybe on the skin of the scrotum, where the cysts can come and go.
I see. Wow, that is great knowledge here. We're here with Dr. Ralph Zagha. We're going to take a quick break, and on the other side, talk a little bit more about his office and Florida Medical Center on the You and Your Doctor Living a Longer and Healthier Life show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back with Dr. Ralph Zagha, urologist, board certified in urology, chief of staff at Florida Medical Center. I gotta tell you, I've seen a lot of resumes, and when yours was sent over, very impressive. So I knew that this would be a show that we're going to hit it out of the park on some info about urology, men, women. Now, in the office, interesting things. So I didn't get to say where your office is located before, but it's right on the campus of Florida Medical Center. 2951 Northwest 2951 Northwest 49th Avenue, Suite 205, Lauderdale Lakes. So that's right next to the hospital. I mean, you can walk from the hospital at a parking lot right into Dr. Zagha's office. And like I said before, a lot of office procedures as well. You were mentioning that circumcision can be done in the office. And this is all listed on the website, vasectomy, et cetera, et cetera.
So,
wow.
And I have a wonderful office staff, and they allow me to do these procedures. The staff is compassionate, they're skilled, and they allow me to offer these procedures that are typically either outpatient hospital-based or ambulatory surgery-based. So we could do office vasectomies. Takes about 20 minutes, a little numbing cream, small injection, outpatient and office-based circumcisions. Again, about a 20, 30-minute procedure. Walk in, walk out. Other procedures we do ultrasounds, a test called urodynamics that checks the bladder function. We do cystoscopies that we could look inside the bladder. We change catheters quite often for people who cannot urinate or have trouble urinating, and even small excisions of different cysts or abnormalities.
I had no idea this was all available in urology. This is great. Has this field really grown since you've been in not only in technology, but just in, it seems like you have this toolbox of just a ton of tools.
Yeah, and it keeps things interesting. Basically, again, what I love about urology is that every next patient is different, so you don't know what to expect with the next patient, whether it's going to be a urinary issue or a cancer issue or a bleeding issue or a kidney stone issue. So we do see a vast array of conditions we could treat both medically or surgically, and we have that in our toolbox.
Definitely. And it's Dr. Ralph Zagha. It's 954-652-0246. And drralphzagha.com, you're going to put in the URL DRRALPH and ZAGHA, so Dr. Zagha's name. Or just Google him. It came right up. It's a great website. That's why it comes right up at the top. As well as in the office, I'm just going to read a couple of them down. Prostate, urinary retention. Oh, I'm going down your conditions treated, so this is not all in the office, so I'm sorry. But you do treat a lot of different things besides prostate. Erectile dysfunction. We see those commercials all the time, but it's really time to go see a doctor if this is an issue, not...
And the important thing about erectile dysfunction is not just about the erection themselves, but it may suggest other conditions that can affect your heart, your carotids, that can lead to a stroke. So who gets erectile dysfunction? We all do as we get older, but particularly people who smoke. So we recommend please quit smoking. Folks who have diabetes, high cholesterol, high blood pressure can also affect the erections. So the first step is to have these evaluated and treated. Once we do our best with that, then we can concentrate on the erection, and we have a vast array of solutions for erectile dysfunction.
That's great news as well. And we talk a lot about on this show because we get a lot of different medical specialties. That the whole system's connected. Like you mentioned the heart right there. You wouldn't think urology and heart, but there we go. I mean, this system is interconnected. So if you have an issue, go see a doctor. And if you have a urology issue, definitely give Dr. Zagha a call and talk to his friendly office staff or Florida Medical Center. You can find him there. He's the chief of staff. So I kind of skipped around a little bit, but I know people are going to ask because you have an office. Do you take most major insurance? I imagine you do.
Sure, I do take most major insurance plans. We do see quite again, elderly population in the Medicare or Medicare Advantage plans. Typically, the Advantage plans need a referral to see a urologist, so they should ask their primary. Okay. They recommend and obtain a referral for that.
And this insurance info is on the website as well, drralphzagha.com, or give them a call at 954-652-0246 as well. Now, testosterone therapy, I know Peter was saying that, Peter Kaplan, who helps with the show, was saying that you do a little bit of that as well. Is that that low testosterone that we hear about that can really affect
Sure. So as we get older, our testosterone drops, and that's a natural part of aging. Some testosterone drop faster than others. We're not sure why. Things you could do naturally would be weight loss to get your testosterone levels higher. But short of that, there's not much else that we can do naturally. So we do have testosterone supplementation. Historically, it's been a form of a gel that you would place either on your shoulder or under your arm. We're getting new therapies all the way from nasal gels to different injections, which a lot of men use, to even pellets that are replaced in the upper part of your buttocks.
Wow. And those, that's something that over a few months you would come into the office, take them and then, or have them put in, and then over a few months.
Yep, every 4 to 6 months you get a new injection of the pellets.
That's what I was getting to.
The gels or injections are pretty immediate, so we get that response fairly quickly.
That's great news. Boy, you have you cover a lot. I'm really happy to have you on. And as well as you cover everybody. I mean, couples, you have couples, men and women that come in.
Sure. And
to your office, as well as same-sex couples, the LGBTQ community. So, as you know, Doctor's Oath, helping people, all kinds of people.
Yeah, we're in Oakland Park, so right down from Milton Manors, so I see a lot of same-sex couples. Again, similar problems with prostate enlargement, ED, and couples come in. I do appreciate when couples come in and we could talk about those issues together and answer any questions or concerns.
Yeah, because who knows more than the loved one? I mean, they're with you every day, so they know what you're going through. And sometimes they can help to explain it a little better.
Sure.
I mean, we see that all the time. And a good time to talk about that community, because you're going to be talking in that community, the Pride Center, which we've had an administration team. We have about 2 minutes, so I'm going to rip through this. But Tuesday, June 18th, you're going to be presenting a lecture there, I believe?
Yeah, that's my first time to the Pride Center. I'm excited to be there in a couple of weeks. And just a short lecture for Men's Health Month being June. So we'll be there with the Florida Medical Center and meet the community.
Nice. Good point. It is Men's Health Month. Wow, it's June 4th. I haven't even thought of it. And I know it's an observance, and one that I should be thinking of. So thank you. It is Men's Health Month. So we've talked a lot about a little bit of everything. We'd love to have you back on the program, but we got a minute and a half or a minute. What are your hobbies and passions in life outside of medicine?
Sure. So I have a wonderful family. I have a loving wife, Stacy. She's also a doctor. She's a dermatologist. I have 3 wonderful and active kids who are excited to start summer camp next week.
Nice.
That school is out.
Yeah, school's out for summer.
And when I have 2 minutes of time, I like to play tennis.
Oh, nice. Okay. Fantastic. Well, again, Dr. Ralph Zagha, it's drralphzagha.com, 954-652-0246. He's Chief of Staff at Florida Medical Center, floridamedcenter.com. You know that one, 954-735-6000. And you're going to be at the Pride Center, so check Dr. Zagha out Tuesday, June 18th. And thank you so much for all the info so quickly. Love to have you back on.
Had fun, David. Thank you.
Thank you, and we'll see you next time.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV. Opinions expressed on the